Water has been used for cooking, healing, agricultural, spiritual, and religious purposes since 2400 BC. Water was used by the people of Asia to combat fevers as early as 1500 BC and the Middle East for harvesting. Despite this, for many years, water exercise was dismissed as a medical intervention and considered to be purely recreational. But over the past few decades, hydrotherapy has been discovered to be extremely effective and helpful for a variety of injuries, especially pertaining to skeletal muscle. And the principles supporting the use of water in rehabilitation are based in physics. Before we begin, surgeon, what exactly is hydrotherapy?
Hydrotherapy is also referred to as aquatic therapy. Hydrotherapy is an activity performed in water to assist in rehabilitation and recovery from hard training or serious injury. It's a form of exercise in warm water and is a popular treatment for patients with neurological and musculoskeletal conditions. The goals for this therapy are muscle relaxation, improving joint motion, and reducing pain. Regular physical therapy also focuses on decreasing pain while improving mobility, muscle performance, motor control, and function. But many patients are unable to perform these exercises on land due to pain or other limitations. This is where water comes in. Hydrotherapy provides an effective, safe alternative for people who can't tolerate participating in a rehabilitation program on land. These patients often show positive results in the unweighed environment that's water, where they're able to perform full range of exercises directed at improved function.
Now, there are several key physics properties involved with water activity. However, for the purpose of this project, we are going to focus on the implications of buoyancy. Let's dive in.
One of the most important properties of water is buoyancy. What happens when an object is placed inside a fluid? Buoyancy is the force experienced as an upward thrust which acts in the opposite direction to the force of gravity on an object or body.
Archimedes' principle further describes this phenomenon. When something is resting in or on water, it feels an upward buoyant force equal to the weight of the water that it pushes aside or displaces. If an object is completely submerged, this buoyant force pushing upwards effectively reduces its weight. It seems to weigh less when it's underwater than it does if it were on dry land. That's why something like a heavy rock feels lighter when you pick it up from underwater than when you bring it to the surface and lift it through the air. Underwater, you've got a helping hand from the buoyant force. In the context of hydrotherapy, a body or body part immersed in water will experience this buoyant force, which reduces the force of gravity on the body and thus decreases weight bearing on the lower part of the body. Let's take the example of an individual with knee arthritis. Knee arthritis occurs when there is a loss of cartilage in between a joint, causing friction when it is used. Buoyancy is used to unload the lower extremity from the effects of gravity, making it a useful tool for those with knee arthritis. It creates an apparent decrease in body weight while submerged. An immersed body with a relative density less than water will be assisted to the surface by buoyant forces. The decrease in pain perception will allow a person to perform a variety of movements with less pain.
Like we have explained, buoyancy is the upward force experienced in the water acting opposite to the gravitational pull downwards. This is often the most attractive quality for hydrotherapy as it helps to take a lot of weight off of our joints in the knee and in the back, giving a sense of weightlessness. As patients feel more comfortable and mobile in the water, they're able to do exercises and tasks that they wouldn't be able to do on land.
Another thing to consider, if the movement is in an upward direction, the same direction as the force of buoyancy, the activity is considered to be buoyancy assisted. If the movement is performed in opposition to buoyancy, it is considered to be buoyancy resisted. For example, in a standing position, a straight leg lift forward would be assisted by buoyancy, whereas the return motion back to the neutral position would be buoyancy resisted. Another example of resistance exercises in the context of buoyancy is a patient recovering from surgical repair of the rotator cuff muscles of the shoulder, who can perform against the buoyant force of water to strengthen and assist in their recovery.
So to conclude, hydrotherapy aids in the rehabilitation of weak muscles and painful joints through the process of counteracting weight, thereby allowing easier movement, and thanks to buoyancy, people can receive effective treatment to help carry on with their lives.
Thousands of people suffer from skeletal and neurological ailments, most of which can potentially be managed and solved with hydrotherapy, all because of buoyancy. Thanks for watching!